Welcome to another edition of Accident Stories. I'm your host, Dr. Steve Eggleston. Today I want to tell you a story about a patient of mine who had a concussion and had some hormonal imbalances caused by the concussion. I'm going to give you a few tools today that you can use to talk with your doctor about the symptoms that you're having. This is pretty common for people who have had concussions, and studies show that about 1/3 to 1/2 of people who've been in a car accident have a concussion. Let's talk about the hormones that are controlled by the pituitary gland deep inside your brain. There are 5 major hormones that come from or are controlled by the pituitary gland. Those are TSH, ACTH, LH, FSH, and ADH. Now, the functions of these 5 hormones together explain why patients have this constellation of weird symptoms after they're in a car accident. They have a concussion, but perhaps the emergency room or their doctor never diagnosed the concussion. There are about 1.3 million concussions in the United States every single year, and according to the National Institutes of Health, most of them go undiagnosed. First, let's talk about thyroid stimulating hormone, that's TSH. Concussions can cause the pituitary gland to not secrete the right amount of TSH, which can lead to hypothyroidism or hyperthyroidism. Hypo means not enough, hyper means too much. If you don't have enough thyroid hormone, it can cause symptoms such as weight gain, dry skin, constipation, cold intolerance, puffy skin, hair loss, menstrual irregularity in women, and excessive fatigue. And some patients who have a concussion are affected in this way. But other people who are in a car accident, a motorcycle accident, or a truck accident are affected differently. Let's look at the symptoms of hyperthyroidism. Rapid heart rate, anxiety, weight loss, difficulty sleeping, tremors in your hands or shaky hands, weakness or generalized weakness, diarrhea, sensitivity to bright lights, and visual disturbances such as blurry vision. Now, those symptoms of hyperthyroidism can also be caused by a brain concussion, which can be caused by an accident. This is something you should talk to your doctor about. I, as an attorney now, talk to hundreds and hundreds of clients every year who come to me for help. And I ask them these questions, and they say, yes, I'm having those symptoms. And I said, did you tell your doctor about those symptoms? And they said, no, I never thought they could be related to the car accident. Well, they can be, folks, especially if they start within a few months after a car accident. If you've been going along, having a happy life, feeling normal, and then you're in an accident, and within a few months you're having these kind of weird symptoms, yes, they're probably caused by the concussion from the car accident. ACTH is adrenocorticotropic hormone, and what's important to know about this is that there are corticosteroid chemicals naturally made by your body that are important in controlling inflammation in your body. They help you to handle stress better, and they help you to control your behavior so you're not kind of a raging lunatic. They help you to keep your emotions under control. And cortisol is one of those. It's produced by your adrenal glands, which is where your adrenaline comes from. And when Cortisol is secreted. It increases the blood sugar level. It suppresses your body's immune system. It helps your body metabolize foods that you eat, such as carbohydrates, fats, and protein. Now, if you're having an imbalance of ACTH in your body, you're not able to handle stress very well. Your behavior may be not very nice to the people around you. You might be having inflammation in your joints, in your body where you've been injured, that won't heal because you don't have the right chemicals to control that inflammation. Now, doctors will give you drugs like an anti-inflammatory, or you can buy them over the counter like Advil and aspirin, that are anti-inflammatory in their qualities. But the reality is, if your body was functioning properly and you had enough ACTH so that it could regulate and give you the right amount of hormones and chemicals to control your inflammation, you would heal faster. So it's important that you talk to your doctors about this. Some doctors, the type of doctors that handle this include endocrinologists, and there are certain MDs and DOs that are very interested in this. They'll do a large panel of laboratory tests, and they'll figure out whether you're having any chemical imbalances that are causing these symptoms. The good news is if they find those chemical imbalances, they can treat you by supplementing you with the right kinds of hormones until your body can heal itself. Now let's look at the next hormone, luteinizing hormone. Luteinizing hormone affects the production of testosterone in the bodies of men and women. They're produced by the Leydig cells in your body, which may be too much information, but it's important that you know that this is a devastating injury and will slow down your recovery. If you have had a concussion to go along with your whiplash and any other physical injuries, you will heal slower. And you need to talk to your doctors about getting some hormonal help so that your body can heal properly. One of those important hormones and chemicals that is really important for the healing process is testosterone. Studies have shown that 80% of people who have a concussion will show low testosterone within 1 year. That's not in a year or after a year, that's within a year. Some much faster. Well, testosterone is crucial for the repair and regeneration of human tissues and cells. And so if your concussion is causing an imbalance in luteinizing hormone, and this is causing a low testosterone level, there are ways to treat it. Please talk to your doctors about this. It's not just testosterone affecting your libido, it's testosterone affecting your body's ability to heal your injured neck or back or shoulder or knee. Testosterone is extremely important, so talk to your doctor and get tested. Let's talk about the next hormone now, follicle stimulating hormone. Follicle stimulating hormone regulates the development, growth, and reproductive processes in your body. It's a companion to luteinizing hormone in the reproductive system. So FSH that's out of balance can also affect your testosterone levels. It also causes the secretion of a chemical called inhibin, which together with activin affects your body's ability to repair wounds. So here are a couple more chemicals that are going to get out of balance if you have a concussion and you have not got the ability to heal properly. Low testosterone, low activin, low inhibin. Talk to your doctor, get some tests done. Let's talk about the next chemical, antidiuretic hormone. ADH affects how much water is reabsorbed by your own kidneys, so it has an important effect in your body on the regulation of water, glucose, and salts in your blood. If you don't have the right balance of salts or glucose in your body, it can affect your blood pressure, or it can cause you to have early onset of diabetes. There are many, many cases that I've handled as a doctor as well as an attorney where patients had early onset of diabetes from the car accident. These are important things you need to get checked. Talk to your doctor about the information we've talked about today. This has been Accident Stories, and I'm your host, Dr. Steve Eggleston. I treated patients in my chiropractic office in California for 20 years before I became an attorney and began handling exclusively personal injury cases. I've handled thousands and thousands of cases. I've handed out checks for millions of dollars to people who have been in car accidents. If you or a loved one has been in a car accident in California and would like to speak with me about representing you for that accident, feel free to call me toll-free at 877-424-4765. That spells 4 Chiro Law. So simply dial 877-4 Law, ask to speak to me, Dr. Eggleston. I would be happy to come to the phone and speak with you personally about your injuries and representing you as your attorney. Now, if you've been in an accident outside of California, there's no need to call me. Talk to your doctors. Talk to your attorney. Use the things that you learn in accident stories to help you ask the right questions and tell your doctors and your attorney the right things that they need to know to help you in your accident. If you'd like to hear more accident stories, things like PTSD, concussions, how to treat PTSD, neck pain, whiplash, or the hundreds of other symptoms that you can have from concussions, subscribe to the Accident Stories channel. If you hit the bell icon, you'll be notified every time I upload a new Accident Stories broadcast. I'm Dr. Steve Eggleston, and I wish you good health and a successful outcome of your case.